Keeping your brain healthy as we age. This is a area that many of us are always worried about. One message is if you think you have Alzheimer's disease, you probably don't have it. And if someone else thinks you have Alzheimer's, you probably do. Um, so we're going to explore brain health at this point in time. As you can see right now, I'm wearing a mask because I'm here with Rachel. Rachel's been here many years. She's at the University of Toronto, going to do her third year. She comes in every once in a while, and it's always good to see her. The reason I think we need to think about masks right now, we're in the fourth wave of this pandemic, unfortunately. This fourth wave with the Delta variant is going to be probably worse than most people anticipate. So plea number one is make sure you're vaccinated and double vaccinated right now. The two vaccines right now are very effective against the Delta variant. We'll probably need to have more updates and more vaccines as time goes on. During this pandemic, I got my shingles shot, and I'm now going to get my pneumococcal vaccination at this point in time. So my tetanus is up to date. Hope yours are too. And is that what we're going to learn about is that vaccines can even protect the brain too, as Hannah's and his team are going to show us in a little while over here. So I'm really excited that Hannah and her team have put really a wonderful presentation. Is how's your brain and what's going to happen to it and how to keep it healthier. Hannah, take it away.
Sure. I guess we'll just dive in today. Thank you everyone for joining and watching the webinar today. So just like Dr. Curnew talked about, we'll be talking all about the brain today. So why the brain is important, how we can define cognitive decline. We'll be looking at a couple assessments that physicians and you yourself can take as well to see where you are in terms of cognitive ability. We'll also be talking about how heart health is linked to brain health. And finally, we'll be talking about a variety of ways to keep your brain healthy and for as long as possible. So I'll just start off with talking about why the brain is important. So I found this quote and I really liked it. I think it sums up really well kind of what the brain is so great for. So it says, this human brain has 100 billion neurons, each neuron connected to 10,000 other neurons. Sitting on your shoulders is the most complicated object in the known universe. And a theoretical physicist, Michio Kaku, is the one that said this quote. And I think, given just the tedious nature of physics, I think saying that the brain is the most complicated object in the universe really says something. But just like he said, we do have about 100 billion neurons, and all of these neurons are connected together. So the more neurons that we have that are connected to one another, the more connections we have. And the more connections we have, the more better it is. And we'll go into a little bit about how we can really kind of look into the neuroplasticity of the brain and make sure that we're stimulating it enough so that we're making all those connections throughout our lifespan.
That's amazing. Hold on for a sec here. 100 billion neurons with 10,000 connections. I thought I was pretty special. I have six computers in my office, but the complexity of the brain is just truly amazing. And as we age, we lose neurons. So need to think about how to keep that preserved. So we start off with lots, and we want to make more connections. And so fascinating. Thank you so much. Next slide, please.
Of course. I think it's important to remember too, in the past, we thought that it wasn't possible to make new connections as we get older, but we're learning even now too as well that we're always able to make new connections no matter how old we are. So taking proactive measures and really stimulating our brain through different activities is really important to get your brain stimulated and healthy as ever. So I've just put a couple of points here. So the brain is responsible for a plethora of functions in our body. It helps us regulate our emotions. It helps us see, hear, and tune into our different sensory systems. It helps us plan. It helps us pay attention. And it also helps us speak. So just being able to access this webinar right now, me speaking to you and you understanding what I'm saying, these are all things that our brain is responsible for doing, and it does a really great job at it as well. So we want to make sure that we preserve that function. An interesting fact that I think a lot of people don't know, though, is that the brain isn't responsible for feeling pain. And what I mean by that is the brain doesn't actually have any pain receptors like the rest of our body. So while it's responsible for processing pain, it doesn't actually have what we call nociceptors that perceive the pain. And that's why we can conduct awake brain surgery for patients whom we have to test cognitive function for. So, for example, if we need to make sure that we're not touching any areas of the brain during the surgery and that the patient has, all their functions intact, the neurosurgeon will ask them, to recall certain numbers back to them or think about a certain memory they had and making sure that the surgery is going well. But additionally, when we have headaches, so it's not actually our brain that's in pain, it's the layers around the brain. So the muscles, the blood vessels, the brain covering that feel the pain and are then processed by the brain. I just thought that was a fun fact I wanted to share. Now, we know with COVID-19, obviously we're still having research kind of coming out, and even the paper that I'll be talking about as well just came out recently last month. But we know that a lot of the symptoms that are coming out for COVID include brain fog, so this concept of not being able to think very clearly, memory loss, strokes, seizures, the loss of sense of smell, and altered sense of taste. These are all related to brain function. In a recent paper that came out with the help of the UK Biobank, it's essentially a database that has accumulated information, I believe, for about 500,000 participants in the UK. So they've offered to participate in studies and allow the brains to be scanned for us to, look at the effects of certain diseases, look at the effects, for example, with COVID. So prior to the pandemic, they got 40,000 participants to have their brains scanned, and then they brought back hundreds of those participants, I believe in March, April this year, and they compared those brain scans, and half of the participants that came back actually had COVID at some point during the pandemic, and half of them had been healthy and hadn't had COVID at all. And when they matched all the participants by age, sex, ethnicity, and metabolic factors such as blood pressure and body mass index, so trying to look at similar patients and how similar patients kind of react to COVID or how they stay healthy over time, they looked and saw that having COVID-19 in the past during the pandemic was linked to reduced gray matter. And gray matter is really important because it's responsible for sensory systems and memory. And when I say sensory systems, I mentioned earlier that one of the common symptoms with COVID that has been coming out has been a loss of sense of smell and altered sense of taste. And gray matter is responsible for tuning into those sensory systems. So our ability to smell and taste seem to be related to COVID. And this paper also exemplifies that as well. So it is suggesting that there is a relation between, our sense of smell and taste and how we can contract COVID. So definitely a very interesting study that's coming out and more research to come as well.
So this tells us is that anything that injures the brain, so I know that concussions, strokes, high blood pressure, they all injure the brain and you have neurons that die. We now know that COVID kills neurons. And so we know that COVID, we say, well, it's not so bad. We know there's actually over 50 long-term problems after COVID in some people. Um, we also realized that when people did have COVID, when they had COVID pneumonia, it causes your oxygen level in your bloodstream to fall. And oxygen, the brain needs oxygen. So by depriving the brain of oxygen, you can probably damage some of those neurons. We also know that COVID causes blood clots, and microthrombus in the brain has been clearly identified and clearly have strokes from COVID. So this tells us that wow, that I don't want to have COVID. And if I want to have COVID, my best defense is still the vaccine right now. Because it helps shed the amount of virus and it lets your immune system work very quickly against the disease. So this is one more example that anything that damaged brains, we're going to learn about things like how atrial fibrillation, how stroke damage the brains leads to, damage and Alzheimer's disease in the future. So it looks like COVID's going to be on that list of things to do. So don't bang your head, don't get infections, and be healthy and keep your brain healthy. So this is actually very powerful evidence that this is a serious problem, and there's a lot you can do to prevent that from damaging your brain. Next slide.
Perfect. And having talked about, what the brain and how it serves us, we'll just be talking about defining cognitive decline in a number of ways. So I think when we think about cognitive decline, we typically think of it as a spectrum. So going from, no trouble at all the way to progressive illness like Alzheimer's. And kind of in the middle there is what we call mild cognitive impairment. So this is an early stage of typically memory loss. And individuals with mild cognitive impairment have problems with memory, language, thinking, or judgment. And the difference with this and, the occasional I forgot where I put my keys would be that these problems are greater than what we would expect from normal aging. So it's noticeable by the individual, it might be noticeable by others around them, like family or friends, but it doesn't affect their ability to carry out everyday activities. So they might have these slip up every now and then, but they're able to recover from it on their own and still do activities independently. Now, the signs and symptoms of MCI will vary between each individual, but they do include memory problems, impaired thinking, language difficulties, disorientation, time and space, poor judgment, and impaired depth perception. So typically, we typically associate it with memory problems, but with impaired thinking, it might be taking some more time to plan certain things out. Language difficulties might include not being able to recall a certain word during a conversation. Disorientation, time and space might include being feeling lost in a typically familiar environment. Poor judgment might mean wearing a jacket on a really hot summery day, like kind of what we're experiencing right now. And impaired depth perception might include something like looking at a dark rug that's on the floor and mistaking it as a hole in the ground. And even with MCIs, we see that there are different types of impairments. So for patients who typically only have memory-based impairments, we would call that an amnestic MCI. But for individuals who have non-memory-based impairments, so not being able to plan, reason, judge, those other impairments would be considered non-amnestic MCIs. And I do want to preface if any of those things that I mentioned as signs of MCI kind of lit out to you and you were thinking, oh, that kind of happened to me the other day or this past week or this past month, don't be alarmed. I don't want to scare you. But if you are feeling like you are forgetting things more than usual and you're noticing different cognitive abilities that are changing, feel free to just reach out to your family physician. It really doesn't hurt to start early. And if you want to take some of those assessments we'll be talking about later, feel free to ask about them. It never hurts to take preventative measures for any illness. But with that said, not everyone with a mild cognitive impairment will develop dementia, but it does increase the risk. So we know that at least 10 to 15% of MCI cases usually progress into dementia. But for the remainder, 80, 85, those patients either stay at the same level of impairment or they'll improve over time. That has also been reported. And with dementia, we look at the difference between MCIs and dementia, and we see that more than one cognitive domain is typically involved in dementia, and there is significant interference in daily life. So with dementia, we'd say that from anywhere from mild to severe dementia, individuals require some assistance with their daily living. And so we would that would be the clear difference between MCI and dementia. Now, I mentioned earlier that amnestic MCIs are usually associated with just memory. So most individuals will just have memory impairments, but given that they're associated with memory, they do have a stronger association with developing Alzheimer's disease later on. And unfortunately, we can't necessarily predict whether someone with MCI will develop dementia because for MCIs, it has multiple causes and multiple outcomes, like I said. So, really, at this time, we can't exactly determine whether they'll get better, worsen, or improve. But it's also important to just evaluate for MCIs, especially for the elderly who might be experiencing more of those cognitive changes. And while we can't predict it, these are some of the risk factors for dementia that we clearly see in the research. So for early onset dementia, or when dementia is diagnosed before the age of 65, usually in the 40s or 50s, that's usually linked to genetics. So certain genes that predispose individuals to developing dementia, having family history. With sex, women have a higher risk of Alzheimer's. Around 65% of patients over the age of 65 are women. And age is the strongest risk factor for dementia that we know of currently. So 1 in 20 individuals over the age of 65 have dementia, and 1/3 of individuals older than 85 have dementia as well. So as we go up in age, we see that there is a significantly higher risk of developing dementia, which makes staying active and stimulating your brain all the more important as we continually age, even when it becomes a bit more difficult to, stay active. And we won't delve into this too much, but we did want to bring up kind of the current treatments there are for dementia. And most of these medications, excluding the last one, these don't necessarily treat them or treat the biological basis of Alzheimer's or dementia. They're instead kind of meant to manage the symptoms that individuals are experiencing so that they can have a better quality of life. But interestingly, the very last one that I have here called Aduhelm. It was just approved by the FDA in June this year, and it actually targets the biological reasoning behind why Alzheimer's develops. And that's because we have this protein in our brain called beta amyloid. And when we don't clear out, we'll talk about sleep a bit later, but sleep is very important in managing the levels of this protein in our brain. But if we have too much of this protein and it accumulates in our brain, it actually can lead to plaque formation. And just like when we talk about the heart and we talk about plaques, it's the same thing goes for this protein. We do not want these plaques to form. It has been associated with Alzheimer's disease. And this particular treatment is actually meant to reduce the plaque formation and actually reduce the amyloid present in the brain. I believe that the clinical trials, they're going through a kind of a bigger one right now, but currently they've tested it on individuals with MCIs and mild dementia, and they found that some patients have had really great success with it. But we have to see whether it will be beneficial for those with moderate to severe Alzheimer's and other dementias as well. So having kind of talked about dementia and how MCIs can turn into dementia, I want to talk about some of the assessments that you might encounter if you speak to your family physician about different, cognitive delays that you're kind of experiencing. So two of the most common ones, one of which is here, is the MiniMental state exam. And this looks at different cognitive abilities like orientation, so knowing the date, month, and year, and memory, attention, language, and visuospatial skills. And I've just kind of added in here what types of questions you would be asked. So this includes things like, where are we right now? What town are we in? Can you name three unrelated objects clearly and slowly? And then repeating them after the physician. We have some serial subtraction. So I would like you to count backward from 100 by sevens, and kind of recalling those items that were mentioned earlier. So can you tell me the names of those three things we mentioned earlier? And just a number of different tasks that will also be seen in other tests we'll talk about as well. But for this one, we say that 25 to 30 is considered normal. And then as we go down, we say that the degree of impairment increases. So 20 to 25 is considered mild impairment, 10 to 20 is considered moderate, and then 0 to 10 would be considered severe. And of course, with any assessment for cognitive abilities, we do want to look at an array of medical history, physical evaluation, and cognitive testing. And same thing goes with cognitive testing. There are several tests that can be performed, so additional testing might be done, but this is typically one of the more common ones administered by health professionals.
So this one was usually called the MiniMental. If you just backtrack one, is that this is sort of the standard test that either a neurologist, a physiotherapist, your doctor, yourself can do as well. So you can actually administer this to somebody else and get a baseline number and write down that number if you want to. And if you go backtrack one more slide, you talk about the medications, is that we've had a lot of a lot of effort to try to prevent Alzheimer's and treat Alzheimer's disease because, as you point out, Hannah, that 1 in 3 over the age of 85 has Alzheimer's, and usually people are saying is that one spouse will have Alzheimer's, the other spouse will be looking after that person. So it's a real devastating disease, and drug therapy up until now has been quite disappointing. This newest drug on the market is a very controversial drug, and it's not been really shown to actually delay symptoms at this stage. It just changed the amount of plaque in your head, and you think changing plaque would be a good thing, but a lot of debates right now. So right now, if you look for drugs to prevent Alzheimer's disease, they're really not there yet. The drugs we currently have available work a little bit, but not all that well. And I think the way I look at it is that the best way to treat Alzheimer's is to prevent it, which you're going to show us in a few minutes from now. So next slide, go back to your slide, the MiniMental. So play
Sure.
around with it, do it on your friends, your neighbors, and of course, let's hear about the second one you want to tell us about.
Sure. So this one is called the MoCA. It's the Montreal Cognitive Assessment for Dementia Screening. It's very similar to the one that I just mentioned, but this one also includes the clock drawing test. And the clock drawing test, actually on its own, researchers have shown that the clock drawing test is quite effective in identifying cognitive impairment. And I'll kind of go into that when we look at a couple questions. I'll be kind of encouraging you to join me in doing one of the questionnaires and we can try doing it together. But for this particular assessment, we would sum up all the subscores. So if you can see, they're all categorized into different tasks. So visuospatial, naming, memory, attention, language. So we just add up all of them. And 26 and above would be considered normal out of 30. And when I was looking at kind of where we would differentiate mild cognitive impairment from dementia, we would say that a cutoff score of 18 typically differentiates the two. So a score below 18 would be indicative of mild to moderate dementia, and then 18 to 26 could be indicative of mild cognitive impairment, obviously with further cognitive testing, but that's kind of the gauge that we have. And I think the nice one about this particular assessment is that it's actually available in more than 35 languages. And with these assessments, one of the difficulties about giving English-based questionnaires to patients is that English is not always the native language for everyone. And with cognitive assessments, doing it in your native language would be the most indicative of your cognitive abilities. So I think it's really great that we have so many languages available for this one.
And these available online that you can just download and things of that nature as well. And we'll give you those sites that you can look at that. I
Yes,
think we have
we'll have them linked.
PDF.
Yeah, we'll have them
Yeah.
linked down below in the description box if you want to print them out. I believe they're all PDF, so you'll just be able to print them out and try them on your own as well.
So this would be a good thing for cocktail parties and to do right now on your friends. So you shouldn't do it on yourself. You get somebody to do it on you. So if you do them, bring them in. We'll put them in your chart. So we'll keep track of how your progress over time. Let's hear about the next one. This is really interesting. Thank you.
Sure. So just like Dr. Curnew said, with the first two I mentioned, those are typically administered by a physician who has had training in administering and scoring them. And this one is a relatively new one. It's called the Self-Administered Gyrocognitive Examination. And it wasn't developed to screen for dementia specifically, but rather cognitive impairments and seeing the degree to which they might have difficulty on a day-to-day basis with cognitive functions. So it includes orientation, simple math, short-term memory, names of objects or animals, problem-solving ability, and the clock drawing test, which I'll show in a minute. I'll kind of show a couple examples of what the clock might look like for individuals who have mild cognitive impairment or a form of dementia. Before we go into that, I do want to emphasize that any test you do at home should be shared with a medical professional. We do not encourage you to self-diagnose yourself. Bring it into your family physician or share it with us at the clinic. We're happy to have them on file. Make sure that all of your specialists and your family doctor is aware that you're looking into these assessments because diagnosing dementia, for example, isn't just based on these written assessments. We look at family history, medical history, do physical evaluations. And in the case of Alzheimer's, we also take brain scans and we see whether there are differences there as well. So it's really important to just share whatever you're doing to take proactive measures for your health as well. So I just want to take a couple minutes. I'll be taking a couple moments for you to just try doing the questions on your own, and then we can chat about the answers. But these are some of the questions from the self-administered one I was just talking about. So the first one over here just says to name the following pictures. I'll just wait a couple seconds for everyone to just take a look. Did anyone have an answer for the for number two? I believe with this one, there are a couple answers for some of the questions. It isn't a one answer fits all. But typically, I think the answers we'd see for this one would be dominoes on the left, and then a pretzel, or perhaps like rope shaped in a pretzel on the right. And then below, we also have questions. So this is measuring abstraction. So looking at how similar two things are. So question number 3 asks, how are a corkscrew and a hammer similar? And then write down how they are like. They both are, and just a couple seconds. And I think for this one, we could probably see a couple answers. But I think in general, we could say that they're both tools, for example. So we'd say they both are tools. And then below are just some more mathematical questions. So how many quarters are in $8.75? And you are buying $1.95 of groceries. How much change would you receive back from a $5 bill?
I guess it depends what store you go to because
Is that so? I'll just give everyone a minute. I think the math ones might take a bit longer.
So
Oh, we
are these
also have this.
questions,
Oh, go ahead.
they valid for people who might not have, let's say, elementary education and don't know, like,
Yeah,
Yeah, so I
absolutely.
think Rachel's asking a good question. So all these scores are based on educational background and so you have to always interpret in that context. Absolutely. Um,
Definitely.
I went to an age at school where all these these timetables and things of that nature, and but if you never went to school, went to different schools, different priorities, absolutely.
Of course. And yeah, for all three of these, when we look at the scoring system, they do take into account the level of or degree of formal education that the subject has had. So if they have, I believe for the MOCA, it was if they have less than 12 years of formal education, then we would add a point or add a point to this final score, not to exceed 30 points, but just to add 1 point to account for those differences. And if you did question 4, number 5, so for how many quarters are in $8.75, we would say that there are 35 quarters. And for number 5, we'd say that there is, if we're giving them a $5 bill and the bill was $1.95, we'd say we're giving back 305.
Are you allowed to use a calculator on this test there?
No, you are not. Yes, if you are self-administering this, please do not cheat and use a calculator. And for this one, I imagine that printing it out and having this next to you will be more helpful, but this is one of the questions that are on the assessment. So copying this picture, just as it is, right over here. And then the next is a drawing test. So drawing a clock and placing in the numbers and making the hands show 10 minutes after 11 o'clock. And on your clock, label L for the long hand and S for the short hand.
It's interesting how clock texts have become quite the norm, but because it's orientation over space, time, and you're going to show some stuff in a few minutes about car accidents and things of that nature, and people who have Alzheimer's disease. You mentioned poor judgment, but also they have trouble judging things into space, and they can get into car accidents more
Yeah,
frequently, especially in
exactly.
cars coming from different sides and turning. Yeah.
Mhm. Yeah, and I think when I was reading about the clock drawing test and its validity, the nice thing about the clock drawing test is how many abilities it's measuring. When we think about drawing a clock on right from, going from nothing to a full clock with a specific time, it's about thinking about what a clock looks like. It's about thinking about what 10 minutes after 11 o'clock means and being able to put that from your mind onto paper. And there's a lot of abilities that are involved in doing the test. So I think it's interesting to see how it's being used in cognitive screening. And I did want to show some examples um, that I came across. So these are all examples of what we'd say are like abnormal answers of the clock drawing test. So we might have to look into another screening and kind of assess for cognitive impairments. So if we see here, some of them, the numbers might be out of order, spaced out kind of differently than we would expect. So having all of them to one side, the time might not be correct. So looking at all those different ways that a clock can be drawn and considering that as well as how it would be scored by a physician. And then the last one over here is just to write down the names of 12 different fruits or vegetables and not to worry about spelling.
Now, I hope people eat those 12 fruits and vegetables.
All the more easier, I think, if you are incorporating those into your diet.
So I think a vegetarian will do better on that particular question.
I don't think they took that into account when they made that question, but that's a good point. Perfect. And for time's sake, we'll move on, but we will have this linked in the description box later on. So if you want to print this out and try it on a family member or try it yourself as well, feel free to, and feel free to share it with us as well.
Is there a time limit for these questionnaires and things?
For all three that I mentioned, I don't believe there are time limits. For the two that are administered by physicians, there are no time limits. You just finish it as you can. And for this one as well, I don't believe there's any time limit.
Well, is that I think as we age, I notice that my brain is losing some of its elasticity, its ability to multitask. And I've learned that really it's not really possible to multitask. I think we get fixed in our own ways. I find simple arithmetic is not as easy to do, and recall is failing, and remembering words. So it's kind of interesting is that so I have two family members. Both my parents, unfortunately, had Alzheimer's or dementing illnesses, so we all worry about that. So what I'm going to do is administer these tests, but more importantly, I'm going to take steps and I'm taking steps right now to delay my brain deaths, and you can do that as well. Because simply having a stroke injures your brain and just accelerates that. Having atrial fibrillation accelerates that, and you're going to show us about these sorts of things. And blood thinners help in controlling your blood pressure and being active and thinking. And I'm going to try to make more neuron connections. Now, one of the things is that can you grow new neurons as we age at this point in time? Does anybody know that?
Um, I think with the research on neurons themselves, I think there has been suggestion. I think in the past we said that we stopped growing neurons in adolescence, and there's some other research that is saying that we are able to grow neurons. But I think as well, even if we can't grow the neurons, we can still grow the connections. So even if we have reduced number of neurons, if we're able to establish the connections and maintain those, that's also very important.
All right. Well, thank you for sharing that. Oh, next
Sure.
question. Okay, okay,
Oh,
gotcha.
this one I think might be difficult to do on here, but I did want to show this question. So this one, it asks you to look at this example and to follow suite on below. Um, and if you want to try this question out, feel free to look at the PDF, and then you'll be able to use a pencil to follow the lines. I think this one's a very fun one, so. Right. And just like Dr. Curnew mentioned, we did want to talk about driving assessments, because one of the things about cognitive decline is that driving can become very difficult, especially if you're going beyond, just the mild cognitive impairment. And I did want to preface that doctors, optometrists, and I believe nurse practitioners are all obligated by law to report anyone they think might have vision conditions or high-risk medical conditions that might make it dangerous for them to be driving. And if that's the case, you might do what we call an on-road driving assessment. So that typically includes a full in-clinic medical assessment where an occupational therapist will measure your vision, kind of see where it's at, see your physical ability, so your range of motion, reaction time, your ability to kind of balance and maintain posture. And then the on-road evaluation would be a joint kind of assessment by a occupational therapist and driving instructor. And they kind of gauge whether you're able to react to the traffic going on the road, and as well your physical abilities with driving. Now, these assessments are not covered by OHIP. They range from $400 to $800 when I last checked. It depends on the location, but we will have a link in the description box with the government website, and that one outlines different assessment centers all across Hamilton and across Ontario. I believe in Hamilton we have 5, one of which is listed down here called Drive Lab. And this is the phone number as well. But there are 5 different centers that you might want to look into if you have to do a driving assessment later. And for individuals with dementia, we would say mild dementia, follow-up assessment is required every 6 to 9 months if they have been cleared for driving, just to make sure that any significant changes in the progression of their illness is taken into account.
It's actually very important because I think many of us we know that people as we age, we think we're safer drivers, but as we get older, our reflexes don't work as well, our brains don't work as well. Um, we're more prone to accidents and simple accidents. So if you think you're not sure if you're fit to drive and you want to be tested, well, you don't need to ask your doctor. You can just go to these places and get a proper report. So I find this takes the burden off a family. If your family member thinks it's unsafe to drive, unfortunately, I had to stop my dad from driving because it wasn't safe to him to drive. And it was a terrible deal because once you lose that independence, of not being able to drive, it's very, very important to look at that. But it's also very important as well um, to make sure, because it's not a right to drive, it's a privilege to drive. And I've known people that have killed people in car accidents. And I had a patient too, I wasn't so sure he should be driving. He had Parkinson's, he had early Alzheimer's disease, and he underwent this test. And he came back with a very favorable score. So I felt really good that he had the assessment and he was able to drive for another 2 years before he actually had to stop driving. But if you would have asked me right off the bat, I didn't think it was a great idea. But after this assessment, that changed things. And there are other people who say you're just being mean to me. And once you develop Alzheimer's disease, you lose the ability to reason, so people can get very angry. So this is very objective. So don't be afraid to recommend this to a loved one that they should get this assessment and book it for them. So thank you for sharing that, Hannah. Very useful information and very important.
Right. And again, we'll have that link in the description box if you would like to look into that as well. And now I'll pass it off to Leah.
Hello, guys. Thank you so much, Hannah. So, I'm going to be talking about the next part, which is how heart health is linked to brain health. So, one question that might be on lots of people's minds are how are the heart and the brain connected? After all, the connection between the heart and the brain isn't immediately obvious, as the heart's in the chest and is responsible for pumping blood around the body, and the brain's located in the head and is responsible for lots of other things like your personality, thought, emotion, and regulating many of our body's processes. But there's lots of research that suggests that there actually is a connection between heart health and brain health. So, one connection is that controlling your blood pressure can actually improve your brain health and reduce the risk of Alzheimer's disease and dementia. So, as Hannah mentioned earlier, both Alzheimer's disease and dementia are cognitive conditions, and they can result in mild to severe memory loss, and can also result in the loss of the ability to carry out other common tasks, such as the ability to participate in a conversation or the ability to respond to your environment. So, while the causes of dementia and Alzheimer's aren't really completely understood yet, recent research shows that treating high blood pressure with antihypertensive drugs, which are drugs that work to lower your blood pressure, can actually reduce the risk of developing dementia or Alzheimer's disease by over 12%. So, this is just another reason among many reasons to control your blood pressure, because not only can it affect other aspects of your health, it can actually affect your cognitive health. Another interesting thing is that eliminating risk factors for cardiac disease can also lower your risk for dementia or Alzheimer's disease. So, one example of this is diabetes. So, diabetes can result in damaged blood vessels and also damage the nerves that control your heart. And this occurs over time, but it can be minimized by taking proper precautions to control the diabetes. But this still can increase the likelihood that heart failure occurs. Heart failure is actually a condition where the heart will not pump blood as well anymore, and this can cause serious problems for your health. But not only can diabetes increase your risk of heart failure and other cardiovascular problems, it can also increase the risk for Alzheimer's disease and dementia. So, when 122 different studies were analyzed that looked at the relationship between diabetes and dementia, it was found that diabetes can actually cause a 1.25 to 1.91 excess risk for cognitive disorders. So, in other words, people with diabetes were more likely to have cognitive disorders such as dementia or Alzheimer's disease, as well as diabetes also making it more likely that you have cardiovascular concerns such as heart failure. So, reducing your risk of diabetes can actually be helpful for both like your heart and your cardiovascular system as well as for your brain. Another super common cardiac risk factor is obesity or being overweight. It has been proven that obesity can play a really large role in cardiovascular disease. And some of the direct ways that obesity has been proven to cause heart disease is because of all the excess mass on your body from all the excess weight. And that can place a huge strain on your cardiovascular system, which will include your heart and your blood vessels, such as your arteries and your veins. So all this extra mass and strain can lead to many future cardiac concerns involving the heart and the blood vessels. Obesity has also been shown to increase the risk of dementia. And there's lots of different theories why, but recent studies have showed that obesity can actually reduce the amount of blood flow to the brain. And it can also increase fat cells in the brain, which can damage brain white matter. And this can lead to a loss of cognitive and intellectual behavior. So that's just another reason to manage your weight and to keep track of your weight because it can even affect your brain and your cognitive function. And finally, the last connection between heart health and brain health that I want to talk about today is stroke. So, a stroke actually occurs when a clot breaks free from one of the arteries in the circulatory system and it gets lodged in a cerebral artery, which is otherwise known as an artery that supplies blood to your brain. So you can think of this clot as like a roadblock that nothing can get past, which means that blood won't be able to move past the clot towards your brain tissue. And since blood is what carries oxygen and glucose to the brain, this block can have some really serious consequences. So brain tissue actually needs a constant supply of oxygen and glucose to survive. So since it's not getting any because of the clot, the brain cells will really quickly start to die, which can be detrimental. And this can lead to severe effects such as memory loss and various other disabilities, such as speech and language problems, which are really common after stroke. So like for example, a common occurrence could be that after stroke patients will have a hard time finding the right words to communicate what they're trying to say, and their speech won't be as understandable as it was prior to the stroke. So this is a neurological problem or symptom, but it's initially caused by a cardiac concern because it's the blocked blood vessel by the clot that's causing the stroke. So having a healthier cardiovascular system makes it less likely that clots will form in cerebral arteries, which makes it less likely that you'll suffer from a stroke. And then on the next slide, on the next slide, these are just some examples of MRIs which show different conditions. So if you look at the one in the top left corner, that's a normal MRI. And then besides it, it's an MRI with an acute stroke. So you can see how it looks a little bit different. And then below it to the left, there's an MRI that's a picture of a brain. It's a picture of an MRI that's of a brain with Alzheimer's disease. And then finally, the one to the right of that is an MRI with a tumor. And this is just interesting because it can show you how doctors can diagnose what strokes look like and what Alzheimer's disease looks like using brain imaging techniques. And another interesting fact is that there was a study done called the Nun study, which looked at 61 nuns who had plaques and proteins that were suggestive of Alzheimer's disease. And those with a history of a stroke. So that means those nuns who had had a stroke before were a lot more likely to have dementia. So that just shows how strokes can increase your risk of dementia, which means again that keeping your cardiac health or your cardiovascular health, being more mindful of it to reduce your chance of stroke can also reduce your chances of developing dementia. And yeah, those are just some of the many ways that the cardiovascular health and cognitive health are linked. And while it's not immediately obvious how the two are related, it's important to remember that all of our body systems are interconnected and interact with each other. And it therefore makes sense that cardiovascular health can have an effect on cognitive disorders such as dementia or Alzheimer's disease.
So this is actually quite interesting. What you showed us some strong associations here. So the Nun study these were individuals who, once they died, they donated their brains to science. And so what happened was that they had complete autopsies of their brains, and what showed is that they were studied that some of these nuns didn't have Alzheimer's disease, and yet they had these amyloid plaques in their brain. They didn't get Alzheimer's. And you mentioned, Hannah, that we have a therapy that helps prevent the deposition of this in the brain, its progression.
Mhm.
And then, Hannah, you told us that high blood pressure can cause stroke and it can cause Alzheimer's disease. So you can see that what damages brain. So one of the things that blood pressure does, it can cause the big vessels to clog up and have plaques and either have atrial fibrillation or heart disease that cause embolic stroke to the brain, and that can cause a stroke. We didn't talk too much about is that high blood pressure affects the small vessels in the brain called lacunar strokes, and these are small vessel disease that can also damage the brain as well. We also showed that having COVID actually destroys gray matter, destroys brain matter. So you can see you can destroy brain from infection. You can destroy it from being overweight. You can destroy it by having stroke. You can just have these genetic factors. And one of the things we didn't really bring up too well so far yet, that smoking and alcohol can actually lead to Alzheimer's disease or to dementia, different forms of that. And so you can see is that in concussions, we know from athletes that many football players had early dementia and we know that soccer players that bang their heads a lot can actually damage their brains as well, and having concussions and things of that nature. So what you need to do is protect your brain multiple ways. So thank you for showing those strong associations. So you're giving me ideas that, from is that I need to know my blood pressure. I need to make sure that if I do have atrial fibrillation, I'm gonna control my diet and exercise. And it's interesting, you can have lots of Alzheimer's plaques in your brain and never develop Alzheimer's disease. And it's that combination of what happens causing stroke. Stroke is a terrible amplifier of dementia down the road. So Leah, thank you for sharing that. Very valuable information. So protect your brain now, so it protects your memory later.
Perfect segue into our next section, which is all about keeping your brain healthy with your lifestyle. So, making sure that you're protecting your brain, stimulating it so that we can continue staying healthy as much as possible. So, I'll just pass it off to Adam.
Sure, awesome. Yeah, I mean, this is a great segue. On the next slide, we're going to talk about. So there's this device called the Cardia Mobile device. I've mentioned this on a couple of webinars now, and Dr. Curnew gave me the opportunity again to come on. Essentially, if you're interested, just email us, and everybody's eligible essentially. And this device is an ECG device that's portable, and it helps you keep track of your heart rhythm. You just connect it to your phone or tablet. Don't worry about setting it up too much. We could help you with that. We have the volunteers here who are more tech savvy. We could help you, get set up with that. And essentially, it's just another way for you to control, to keep measure of your heart health. It's another way of keeping track of your heart rate, amongst other things. On the next slide. So this is a 6-week program, and here are some of the things we want you to measure. And I feel like it's just so important, right? We've talked about exercising, we've talked about blood pressure and its association with Alzheimer's and dementia. We've talked about a lot of these things, and this is where we put this into practice. It's not enough to know; it's also taking action. So measuring your blood pressure daily, and so recording that, walking 3 times a day, and recording the Cardio Mobile device before and after, and just sort of seeing if there's any difference. If you're feeling symptoms, for example, if you have atrial fibrillation or you're prone to palpitations or something, just sort of recording it at that moment and seeing if there's anything that comes up. There's also something called the 6-minute walk test, which is pretty neat, I think. And so you set up, for example, 2 pylons or 2 objects that are a certain distance apart, let's say 10 meters, and then you record how far you could walk within that 6-minute period. And so you could also keep track of yourself over that 6-week program. As well, we have our book 30 Days to Healthier You, and our YouTube channel, which are really helpful for you to sort of supplement a lot of this knowledge. And I just want to sort of finish off with this, is that it's really, really important for us to take matters into our own hands, per se. And that used to be back in the day where, you come to the doctor and you're like, hey, solve my problems for me, and give me a diagnosis. But it's not like that anymore. It's more, you come into the doctor and we want you to come in from a place of collaborative approach, where you come in with information and you come in with knowledge, and we try to help you in that area. Same thing with school, where you don't go to a teacher and you're like, hey, teach me math. You sort of do tests, you figure out what your weaknesses are, you know where you want to go with it, and so you push yourself in that direction. And so again, everybody's eligible, and we really encourage you to apply, and really want to make sure that you're taking things into your own hand, and really pushing yourself. I'll pass it on here to Dr. Curnew if you have any words.
Yeah, so I think is that you mentioned it's not enough to know and some action phases. So we gave you some tools here so you can see what your brain function, if you want to do the MOCA or the MiniMental or this new test for checking cognition and checking that over time. And if you feel it's not safe to drive, you go to get a driving test. If you feel that you want to try 6 weeks with us about really making some changes, some lifestyle changes, some fitness tests. We'll look for atrial fibrillation. We're also going to administer something called the Kansas City questionnaire, which I think heart failure is going to be the leading cause of deaths in our society, or it's going to have an impact on your quality of life. So when you say that 1 in 3 Canadians who make it to 85 years of age are going to have Alzheimer's disease, you know what? I know how to delay that to make a bigger dent right now, and Hannah and her team are really showing us that. So keep moving forward, guys. Thank you so much. What else can you tell us?
Perfect. I'll pass it off to Haley.
Yeah, thanks, Hannah. So next we're going to talk about eating healthy and how a healthy diet actually contributes to improved brain function. So a healthy diet is actually pretty essential for many aspects of our life, including proper brain function. It can actually drastically impact your body and sense of well-being. So when you provide your body with the proper nutrients, you kind of help yourself become more physically and also mentally healthy. So we're actually going to talk about one diet in specific, which is the MIND diet. The MIND diet is actually specifically designed to help boost brain function while incorporating nutrient-rich foods. Specifically, it's actually designed to prevent dementia and a loss of brain function as you age. So MIND actually stands for Mediterranean-Intervention for Neurodegenerative Delay,
which means basically is a combination of the Mediterranean diet, which we've touched on, and then the DASH diet, which we've also touched on before. So it kind of takes these diets and takes the parts that really primarily focus on your brain health. Sorry. Although these two diets are kind of known for being some of the healthiest, both have been seen to kind of lower blood pressure and reduce the risk of diseases such as diabetes, heart disease, which we know, because Leah already touched on, is really important to kind of improve our brain health as well. However, the Mind diet kind of takes those aspects of both the diets and creates a way that we can improve brain function and actually prevent dementia. So there are actually no current kind of set guidelines to follow the Mind diet, but rather there's 10 foods that they encourage you to consume and kind of 5 that they recommend you limit. So the 10 foods that you're encouraged to eat are 6 or more servings per week of green leafy vegetables. So these are things like spinach, kale, kind of those really green foods that you can get. And then also they suggest to choose a non-starchy vegetable apart from the leafy greens, so they're separate from the first guideline. So this is like carrots or like cucumbers, maybe some, I'm blanking on my vegetables, peppers. And you're supposed to consume some of these at least once a day. And then the next guideline is 5 servings a week of nuts. So these are things like peanuts, walnuts, kind of nuts are a great snack and also provide really awesome healthy fats as well. So next one is 2 or more servings a week of berries. They specifically actually recommend raspberries and blueberries because those have been shown to have various health impacts. So next one is at least 3 servings a week of beans. So these can include like kidney beans, maybe chickpeas are also kind of embodied in here. So things like that. And then next is 3 or more servings a day of whole grains. So these are things like whole wheat toast, maybe some oats, maybe some corn's a good whole grain as well. And next is to eat fish at least once a week. And specifically, we recommend fatty fish, so things like salmon. And Dr. Curnew actually recommends eating this around 3 to 5 days per week. Next, they recommend you eat poultry around 2 times a week, so things like chicken or turkey. And then also, they ask you to use olive oil as your main cooking oil. So no butter, no kind of canola oil, no margarine, just kind of focus on olive oil if you're going to be preparing something. And then lastly, this is kind of an optional one, and it's typically they encourage you to seek your physician's guidance on this one, but they also recommend consuming 1 glass of wine. Although they say kind of white or red wine, specifically, they kind of want you to go more towards red wine because research has shown more health benefits in consuming red wine. But again, this is optional and it's approved by your physician. So those are all like the big guidelines. I recommend taking a screenshot of those because there is a bunch to go through there. And then there's also 5 foods they encourage you to avoid. So they ask you to consume less than 4 servings of red meat a week, consume less than a tablespoon of butter or margarine daily, consume less than 1 serving of cheese a week, and consume less than 5 servings a week of pastries and sweets, and then consume less than 1 serving of fried or fast foods. Now, it's important to note that these recommendations seem like a lot, and it's totally okay if you are unable to kind of consume the targeted amounts of these kind of specified fruits and vegetables or kind of foods. I know it's pretty overwhelming. That would be a drastic change in my diet as well. So research actually shows that following the Mind diet for even a moderate amount is associated with a reduced risk of Alzheimer's disease. So we actually recommend to kind of start slow and maybe progressively add things into your diet. So maybe instead of having crackers, you sub a snack in for nuts or berries. Maybe having oatmeal instead of having kind of a different kind of cereal in the morning. Things like that are small changes that you can make over time really can help kind of fitting in with the recommendations that this diet make. So experts actually caution against diving too quickly into the Mind diet and recommend starting slow. So that's why we also encourage you to kind of start slow, because if you start slow and kind of go gradual, it's more likely to stick. And the Mind diet, another kind of forewarning, it's actually not that strict. It's simply just making the effort to try and reduce your high fat and red meat intake and increase your vegetable intake, fish intake, and fruit intake. Next slide,
It's
please.
interesting. If you just go back one slide there, what to do about all these sorts of things. So, unfortunately, the diet research is based on what we call observational data quite a bit of. So, I think most of these are really good, healthy foods. And at one time, people were taking all sorts of vitamins and supplements. And one of the things that oxidation is actually kind of important in healthy foods that are pro um, anti-inflammatory or people are talking about, and that's not a bad concept. What to do with this information? So one time, people were taking vitamins and anti-inflammatories, and those turned out to be negative. Interesting. You mentioned, alcohol. When I grew up, red wine was supposed to be so healthy, but as time goes on, we're learning that it may not be the case. It's alcohol. One drink per day will increase the risk of atrial fibrillation by 10%. Atrial fibrillation increases the risk of stroke, and that's not a good thing. And so I'm of the opinion right now that alcohol is now considered a type 1 carcinogen. So if you enjoy alcohol, there's really no health benefit to alcohol, but it may have some potential harmful effects. So if you're trying to lose weight, there should be no liquid calories. And as you know, 1 gram of alcohol, 7 calories, and there's lots of alcohol and lots of calories in alcohol in the mixtures there. So um, I love this diet. I'm not so sure I'm going to have alcohol. I don't think I recommend it. Doesn't mean I won't have a drink every now and then, but it's not healthy. Uh, all the things that you say are very reasonable. And so I'm a big bean fan at this point. I'm more plant-based eater right now, and uh, do I cheat? I love my desserts. I'm struggling with that, and I'll keep working at that. So I'm going to have this healthy diet, as you mentioned, with some modifications. But thank you for sharing that.
Yeah, that's really important. And that's why it's kind of optional and advised by your physician, because ongoing research tells us different things. So the more up to date your physician is they're going to provide you kind of the better direction, which is why they kind of made that note about the alcohol thing. So the Mind diet and the Mind. So when assessing, basically a study kind of took a group of participants, actually in fact 960 with a mean age of 81.4 plus or minus 7 and 7.2 years, and saw kind of how well they adhered to the Mind diet, and compared that to their change in cognition over around 4.7 years. Participants actually who had the highest adherence towards the Mind diet tended to score more favorable in a risk profile for preserving cognitive ability. So things like having a higher education, greater participation in cognitive and physical activities, and lower prevalence of cardiovascular conditions. So that's kind of a separate thing, showing that kind of a healthier, more active lifestyle, and the more likely you are like working your brain, you're probably actually going to tend to have a kind of healthier or greater adherence to a healthier diet. In other news, when adjusting for significant factors such as the ones kind of listed before, the Mind diet score is actually positively and statistically associated with a slower rate of cognitive decline. And actually the difference between the lowest Mind diet score and the highest Mind diet score group was equivalent to being around 7.5 years younger in age. So the people who kind of were more closely following the Mind diet actually were kind of like younger, even comparable to the same age as those who were least likely and least aligned with the diet. That's a pretty important difference, and that can really drastically impact how you're feeling and how your mind's also working. A study also looked at the adherence of the Mediterranean DASH and Mind diet and its impact on Alzheimer's disease risk, and they found that adherence to all 3 diets can reduce Alzheimer's disease risk, but even moderate adherence to the Mind diet actually also decreased Alzheimer's disease risk, which kind of goes back to when we said starting slow and kind of including the factors of the Mind diet into your diet. Even if you start slow, they're still going to see an impact, which has been shown in that study. Next slide, please. So although there's kind of a bunch of things, like for example, the nuts suggestion, it can be pretty broad. So we kind of thought we'd narrow it down to 2 specific nuts that have actually been shown to have pretty great health impacts. So both peanuts and walnuts actually have anti-inflammatory and antioxidant effects and can protect against oxidative stress, which can negatively impact your body and cause a bunch of different conditions. So, in specific, adding walnuts to your diet has actually been found to improve cognition and reduce the risk and progression of mild cognitive impairment and Alzheimer's disease. So that's pretty cool. And similar to walnuts, peanuts also have been found to have cognitive impacts. So long-term high consumption of peanuts has actually been associated with a lower likelihood of having poorer cognitive function. So that's pretty cool. So maybe try and focus on incorporating those 2 nuts to start. If you kind of want a place to go for what nuts to include, those are 2 really great options to start off with. On the alternative note, too much sugar consumption or excess sugar consumption among older adults actually has a notable association with poorer cognitive function. So one study actually kind of compared sugars and see what was up, and they found that higher intake of total sugars, free sugars, sucrose, lactose, sugar-sweetened beverages, sugar-sweetened cakes, and desserts were actually found to be significantly associated with worse cognitive impairment. But on the other hand, consumption of like cooked dishes, so ones that were prepared by you and like home cooked meals rather than maybe ones thrown in the microwave or the oven, and fruits were actually significantly associated with better cognitive function. So that's kind of an important note because it's not all sugar necessarily. So if you're kind of craving something sweet, try and opting for maybe a fruit instead of going for like a muffin or a cupcake or something like that. But all in all, the kind of key takeaway is to just try and incorporate small changes into your diet and kind of make yourself healthier, and you will see an impact.
Thank you, Hallie. All right, I'll just give it off to Jaden. Take it away.
Yeah, so it's no surprise that regular exercise is crucial in maintaining physical and cardiovascular health, but the brain is actually no different. And you may be wondering what exactly I mean by regular exercise and what kind of activities and how long we should be doing these per week. But ultimately, everyone is different and there's no set number of hours required to guarantee a healthy brain. But albeit the case, it is suggested by medical professionals an average of 150 hours per week of moderate to high intensity aerobic activity and some sort of muscle strengthening activities thrown in the mix here and there.
I think you meant minutes. That's good. I think the hours are a good idea. If not, you'll be a super athlete. But my recommendation is that the minimum is 150 minutes a week, including some, what you mentioned, some strengthening exercises. But I think realistically, the best I've seen is usually about an hour a day should be the major goal for most people. Take it away there, Jaden.
Yeah, sorry, I believe I accidentally said 150 hours. That was 150 minutes per week. Sorry about that. But essentially, any sort of physical activity that can get your heart pumping and muscles working will do the trick. And this is largely because exercise stimulates the brain in similar ways to mental and social activities. So diving a little more into the specifics, physical activity has been shown to lower blood pressure and improve blood flow to the brain, as well as reduce inflammation and the levels of stress hormones throughout the body. So essentially, an increase in the amount of oxygen and energy reaching the brain leads to improved cognition, which is ultimately the goal that we're looking for. It's also been seen to increase the thickness of the cerebral cortex associated with general intelligence, as well as promoting neuroplasticity and neural connections, resulting in an easier time forming new neural connections and stronger memory retention, as well as a stronger memory consolidation. It can sometimes feel daunting to start exercising, even for myself as well, but it is important to start small and develop habits to build your way up. So I know for myself, over the past summer, I found a new interest in golf, and I use it as a way to stay social as well as staying active for a couple hours per week. But there are plenty more opportunities for physical activity available to us all. So some activities to start off with can be as simple as standing and stretching while watching TV, gardening and yard work, a walk or light jog with the children, grandchildren, dog, or even swimming in the backyard or local pool is a great way to stay active while having fun at the same time. So exercise is by no means limited to these activities. And once again, anything that can get you up and moving and blood flowing is perfect towards your 150 minutes per week, or recommended 150 minutes per week. And then next slide. As some of you may know from the previous webinars.
Go back one slide again. You
Mhm.
mentioned about, when you're watching TV, is that Jerry and his team just put together a short video on chair exercises. So I recommend next time you watch TV, you have your computer on and do the chair exercises as you're watching TV, if that's something you need to think about that. So, and if you don't get a dog, get a goat or something. We can walk goats with you if you want, or do something, but just get out there, the joy of activity. And I'm going to say this, if I had to pick the best thing you can do to improve your brain health and your mental well-being, is spending an hour of activity most days. I heard one of our famous neurologists give a nice lecture on this. He talked about all the drugs, the therapies, and he walked away with this as the most important thing you can do to prevent or delay Alzheimer's disease or dementia is to walk, walk, walk. So really think about that. I think everything's important that we talked about, but I would start off with activity as my number one priority. As Hannah and others will point out, when you're walking, you're putting neuron connections. You're hearing the birds chirping, you're looking around, you're thinking, you may be socializing. Jane, you're doing this with golf, and that's a fantastic way of doing that. And tomorrow morning, I'm going to be playing tennis at 6:30 at Linden Park. If you want to come join us, you can. And Adam, let's do the stairs this Monday morning. I'll be there for 6:15, and maybe I won't be late this time. But as long as it's not raining there, Adam, let's do the stairs. And anybody else wants to join us, we'll be at the Shadok Stairs.
Looking forward to it.
And don't forget, we'll get those cardiac mobile devices, and we'll do our 6-minute walk test. So keep going there. Thank you so much for sharing. And thanks, Mike. We're going to go bike riding this weekend.
Yes, just walking is great just because it does put a lot of the different areas of your brain to the test at once. And for chair exercises, I know my personal favorite is the chair dips. But as some of you may know from the previous webinar, sleep is another vital factor in maintaining a healthy brain. And as I was kind of mentioned earlier today, rather recent research has shown that sleep plays an important part in removing toxins and plaque-forming proteins that accumulate over the day, but it's also responsible for consolidating memories and improved cognition while awake. So once again, these numbers are subjective to the individual, but it is suggested by the National Sleep Foundation that adults 18 to 64 years of age receive 7 to 9 hours of REM, or rapid eye movement, or deep sleep each night, and adults 65 plus receive 7 to 8 hours of REM sleep each night. And just kind of to connect these two healthy brain factors together, a longer, deeper sleep can actually be achieved by exercising during the day through more sun exposure, stress relief, and then obviously exercise does tend to tire you out. So just like putting in the time each day to exercise can also, or has been shown to achieve better sleep like later on in the night. And then for more information on how sleep affects our body and how we can achieve a longer, deeper sleep, feel free to refer to our past webinar on the YouTube channel, because it's packed with tons of great information.
Yeah, I'm going to put a plug in for, we have 2 YouTube videos on sleep, a short and long one. I would recommend anybody who has a sleeping problem to look at the sleep videos. We had one of our respirologists give us a really excellent review, and one thing that I learned is I'm not getting enough sleep, and so to me, the way I would recommend that you do is really work hard at thinking of how you sleep. So when you sleep, you actually have restorative function. You help cleanse the brain of some of those plaques that were developing over time, those amyloid deposits. But saying that is that as we get older, our sleep is more fragmented. None of us have that degree of REM sleep and things of that nature, or just different phases of sleep. So to me, is if you feel rested, that's a good thing. And we all need different amounts of sleep. But one of the things that we probably underestimate the value of the cleansing ability of sleep in general. So thank you for sharing that. And to me, my best sleeping pill is exercise. I feel better and I sleep better. So absolutely, thank you.
I also wanted to make a comment. Dr. Gottschalk, the specialist that came onto our webinar about 2 months ago, he made a metaphor. He was saying that during the daytime, you can think of our brain like it's the busy streets of New York. You know, everything is happening all at once. And when we go to sleep, it's almost like the early morning taking out the garbage. And if you don't get enough sleep, you're not going to be able to take out the garbage. So it's really important to get that sleep. All right, and I'll pass it off to Serena to talk about stimulating your brain socially and intellectually.
All right, you can switch to the next slide. So one thing that is important to keeping a healthy brain is to be social. So this can include a bunch of different activities like getting together with friends, volunteering in the community, or even participation in clubs, essentially anything that allows you to interact with other individuals. And being social with others has been found to be associated with lower rates of disability and mortality. It's also said to help reduce feelings of depression. So there have been studies to show that maintaining a healthy diet, exercise, and social connection has led to less cognitive decline in older adults, and some of whom are also at risk of Alzheimer's disease. So those who are more social have been found to perform better on tests of memory as well as other cognitive skills. And so there has been some evidence that being social can help, which can also lead to helping reduce the risk of dementia. Especially during COVID-19, people have been in isolation, and maintaining social interaction is important. So especially in our situation, using our phones and different online platforms to stay connected. Many people also stay connected through social media or even playing online games with others. So there's many different ways to socialize with people, whether it's online or in person. And so stimulating your brain is also another really important way of keeping your brain healthy. Your brain is similar to a muscle, and so it's important that we use it. And when I say stimulate your brain, I mean things that will help to challenge your brain. Studies have been able to show that by challenging your brain, you can also help to reduce the risk of dementia. We kind of touched on this earlier this evening, but essentially we're always growing new brain cells, or at least some studies say that we are still growing some new brain cells, even when we are in older age through the process of neurogenesis. But other studies have also shown that brain cells are also very malleable, so we're able to grow and make new connections in our brain. And when challenging your brain, it's important to make sure you engage in these different activities that actually challenge you. So these are things that are new to you or are hard for you to do so that you can help build these new connections. So some tips onto finding activities that can help challenge your brain are, one is to pursue lifelong learning. So maybe that's learning a new language or engaging in hobbies that make you interested in learning more. Learning new things throughout your life can help build your cognitive reserve. Another tip would be to play games that involve your mind, such as puzzles, memory games, or even video games to always stimulate your brain. Another interesting tip is to try to break your routine. So changing the order of certain things you do in your day or creating a new routine are some small things that can help you challenge your brain as well. And then also cross-training your brain by by working on things that you're not so good at and try to improve them and give your brain some flexibility is another really cool way of challenging your brain and kind of helping make those new neural connections. And now, Hannah, if you want to talk about this group.
Yeah, sure, I could.
Go back one
Yep,
slide
go
again. This is actually kind of important. You mentioned about there's a fair bit of research what doesn't work. So people talked about these different mind games and things of that nature. That by itself wasn't shown to be all that effective. Hannah, you made a really point early on, forming more connections. The best way to form new connections in your brain is to learn new skills. So you're 80 years of age. The best time to learn about computers when you're 80 years of age. You're going to form a lot more new connections than watching a video game on TV. So learning new skills is probably an important step in neural connections. And that's what exercise does, and walking and things of nature. You're out there and learning new skills and thinking, but also enjoying things. As Stuart keeps pointing out, the Harvard did the largest long-term study and shows the best correlation of longevity is basically is quality multiple relationships. So you can see how that interacts. So if you're going to sit watching a computer game and you're not going to be too active over time, you're not going to measure your blood pressure, and you're going to have a high fat, high sugar, high salt diet, and have a couple beers and watch the ball game, and then retire early in life, and not have relationships and not get all your vaccinations in order. You're in trouble. So I got my shingles vaccine because I don't want reactivation of the chickenpox virus into my brain and eyes and skin. I'm going to get the pneumococcal vaccination because I don't want to have pneumococcus pneumonia, becomes a big problem after the age of 65 years of age. I'm going to make sure I not give drugs to suppress my brain activity. So sleeping pills may actually make you more demented over time. Um, these are just one of many examples of that. So thank you for really reminding us about this right now. And one of the things is that don't get hard on yourself. The next slide, please. We learned a lot about from I call the 3M group. This is a group of fantastic, very skilled individuals, and I feel bad that I probably got the most benefits so far than most of any people from that group, and I hope you take advantage of this group. Hannah, tell us more about this group.
Yeah, sure. I've just put some pictures here for kind of a frame of reference about who I work with in the group. But we're a group that meets on Wednesday evenings at 7 p.m. We meet on Zoom, which is a video conferencing platform. And sometimes we'll do exercise, sometimes we'll just chat about how things are going. But the purpose of the group is really to just have an opportunity to talk to other people, talk about how our exercise journey is going, because doing it alone is often more daunting than it is to have each other to encourage. But we also offer individual support if you're not feeling up to those group sessions, and we do those on Wednesday afternoons as well. I personally facilitate those calls. So if you are ever interested, please email us at drcurnew232@gmail.com. And even if you aren't if there's anyone you can think of that isn't a patient at the clinic but would be open to attending the group, please feel free to ask them if they'd like to join. We're happy to have them in the call. It isn't just about medical related topics. We talk about things related to mindfulness, to well-being, stress management, different types of exercise. So it's really an all-around just promoting good health and good relationships. So happy to have you if you are interested. All right, and I'll pass it off to Sumin to talk about smoking and alcohol.
Thank you, Hannah. So I'll be talking about the effects of smoking and alcohol in our brains. Next slide. So the reason why smoking is addictive is due to its effects on our brains. So as you know, the potent chemical in cigarettes is nicotine, and our brain has receptors for this molecule. And when we smoke, the nicotine binds to these receptors, and it gives us a sense of reward. And this causes us to seek more cigarettes, but the more and more you smoke, the greater the withdrawal symptoms and the cravings for smoking. But aside from this neurological reward conditioned effect, smoking can also impact your cognitive and mental states. So there's growing evidence that smoking is associated with cognitive and mental state decline and impairment. And there was a recent meta-analysis that looked at 19 different studies, and it found that current smokers had a higher risk of dementia, such as Alzheimer's disease and vascular dementia, than those who never smoked in their lifetime. And in fact, about 14% of Alzheimer's disease cases worldwide can be attributed to smoking. And smokers on average also have a slightly poorer global cognitive functioning and memory in later life, and a higher risk of stroke. And recent findings have additionally found that it also leads to a smaller brain volume as well. So next slide. So this was a retrospective study that was published in 2015, and it looked at smoking and the thinning of the brain cortex. So it had around 500 subjects with smoking history data and MRI taken at the age of 73. And the study found that current smokers had generally thinner cortexes than lifetime non-smokers and ex-smokers. And the yellow and the orange regions that you see in the pictures there, those are the differences between the two different populations. And many of the most significant regions were in the prefrontal cortex, which is involved in thinking, judgment, planning, and many of our important cognitive functions. But the differences were also seen in some primary motor and sensory and occipital regions as well. And ex-smokers also had a thinner cortex than lifetime non-smokers, although the differences were less extensive than current smokers versus non-smokers. But again, the primarily affected region was in the prefrontal cortex. And a dose-dependent negative relationship was also found between cigarette smoking and cortical thickness. So this meant that the more you smoked, the thinner your brain cortex was. And so given these findings, it's undeniable that smoking can have negative consequences beyond just your lungs. Cortical thinning is a biomarker of cognitive aging, and now we know that this can be accelerated with smoking. But as we saw, the differences in cortical thickness was less between non-smokers and ex-smokers, so there is potential to recover some of the thinning caused by smoking with quitting. Next slide. So if that wasn't enough to convince you to quit smoking, here are a few other more benefits of quitting smoking. So you can return to your normal heart rate and blood pressure, allow nerve regeneration to smell and taste better, improve your lung, heart, and circulatory system, can cough and feel out of breath less often, decrease your likelihood of stroke or heart attack, and improve your breathing and decrease your chances of getting cancer. Next slide. And additionally, and perhaps maybe most importantly for some of you, you can protect those around you. So in the US, 50,000 deaths per year can be attributed to secondhand smoke. And just as smoking can have an impact in your cognitive function, secondhand smoke can also impact the cognitive function of those who breathe it, as well as increase the likelihood of dementia. So if you aren't convinced to quit smoking for the sake of your own personal brain and lung health, please consider quitting for your family members, grandchildren, and those around you. And if you're interested in quitting smoking, our clinic also offers smoking cessation calls on Tuesdays and Fridays. It's ran by another volunteer named Alan and I. And we just go over how to set a quit plan. We discuss strategies and aids that may be useful in your quitting journey. Next slide. And now I'll talk about the effects of alcohol on our brains. So we're all familiar with the immediate effects of alcohol on our brains, such as blurred vision, slurred speech, and slower reaction times. But heavy drinking can also have long-term consequences as well, and its effects can range from mild memory impairment to permanent and debilitating conditions. In fact, over 200 diseases, conditions, injuries linked to alcohol, memory impairment is one of the most severely affected function, as it can damage our hippocampus region, which is where our memory is made. So an example of this is on the next slide. So Wernicke-Korsakoff syndrome is an example of a memory condition linked to alcohol. And up to 80% of alcoholics also have a thiamine deficiency, and some progress into the syndrome. So this comes in two parts. So the first part is the Wernicke encephalopathy, and this involves mental confusion, paralysis of the nerves of the eyes, difficulty with muscle coordination, and this occurs more short term, but it can progress into the Korsakoff psychosis, which is more long lasting. It can cause you to become forgetful, quickly frustrated, and impair your ability to make new memories. And up to 25% of patients may eventually require custodial care. So now you may be wondering how much drinking is okay. And on the next slide, so as Dr. Curnew and Haley discussed earlier, there are benefits that have been discussed in the literature, but as he mentioned, these benefits are the negative consequences of drinking alcohol obviously outweigh the potential benefits. So it's still probably not a good idea to start drinking just for the potential benefits that aren't really backed by high quality of evidence. So it's also suggested that if you are going to drink only a little bit and spread it out over 4 or more days per week, as opposed to drinking a large quantity all at once.
Thank you so much. And Swati, I'll just pass it off to you.
Hi, my name is Swati. So I'm going to be talking about how to prevent falls and brain injury. I want to switch to the next slide. So kind of the reason that we're talking about this is kind of related to something that we mentioned earlier about exercise and how that's really beneficial for brain health. And by preventing falls, you're basically increasing your chance of being able to exercise later on in life, and that's super important. So kind of an interesting thing I heard about on the radio a few days ago about exercise and brain health was a study that they did on fish, where they basically stimulated exercise in fish by like poking them with needles, and that stimulated exercise, and they made these two groups of fish go through mazes, and they found that the ones that were stimulated to exercise, they went through the maze much faster, made much less, like much fewer errors. They were just generally more competent at going through the maze. And that kind of shows that, you know, it applies in fish and applies in humans as well. So exercise is super, super important in preserving your brain health. So now coming back to falls, I was reading this book today. It's called Being Mortal, and they describe this patient with like many comorbidities, like heart problems, lung problems, many previous surgeries. And the doctor was examining this patient and said that, like, aside from all those comorbidities, their biggest risk factor for not being able to kind of maintain their daily functioning was falling. And even with all those comorbidities, falling was still the greatest thing that might have impacted this person's health. So the risk of falls kind of increases with age, and with the increased risk of falling also comes the fear of falling, which can lead people to avoid physical activity, and that can also lead to falls, and that can have a detrimental impact on a person's brain health. But luckily, there are a number of ways that one can prevent the risk of falling or reduce the risk of falling. And that includes some of the things mentioned on the slide. So practicing balance and strength exercises. I think there are a few videos on the YouTube channel dedicated to these strength exercises that can be really helpful. Stretches can help improve your balance, and that can reduce your risk of falls. Another thing is shoes, which may seem like a pretty simple thing, but having a bad pair of shoes can really increase one's risk of falling. So it's super important to have a durable, sturdy, and safe pair of shoes. Some tips when going shoe shopping include avoiding laces and being on the hunt for low heels and slip-resistant shoes. So a lot of the literature right now suggests that these low heels and slip-resistant shoes can greatly reduce the risk of falling. They can also improve your balance and allow you to continue your daily exercise without having that constant fear of falling. Mobility devices, lastly, can also reduce your risk of falling. So those are the things that I think we all know about: canes, walkers, other assistive devices. Just make sure to use those properly and use them in a way that will reduce your risk of falling. Go on to the next slide. Another thing to keep in mind when it comes to falling and why it's so important to talk about it is the risk of concussions. So Dr. Curnew, I think, wanted us to mention that everyone watched this movie called Concussion, in which a pathologist raises awareness about concussions for football players. So it'll just provide you with some insight onto the dangers of concussions. So basically, long story short, any contact with the hard surface can put someone at a significantly higher risk of developing a concussion. That's really important to keep in mind. Other things that can help you maintain your balance, mobility, and strength include different support programs. So for example, the Stay Well program at St. Joe's is a physical maintenance program for patients with a broad range of medical conditions. They offer therapeutic, safe, and effective exercises to many at-risk patient populations, such as post-stroke, patients who have a history of heart disease, diabetes, renal failure. They provide therapeutic exercises that are focused on balance and strength. So being a part of these different support groups kind of gives you a community to be part of and helps you directly get that support that you need, and also helps you kind of recognize the importance of developing that balance. So when you're in situations where you want to go for a walk or something, that you don't feel that fear of falling. And there's also a number of different fall prevention programs. If you just look up fall prevention programs by the YMCA, the different organizations listed on the slide right now, if you want to take a screenshot of this as you're watching it, those can be really helpful as well, again, to provide that sense of community and to help people recognize the importance of preventing falls. That's kind of all I had.
Perfect. Yeah, and thanks, Swati. I'll just add a comment as well for the fall prevention programs. I have a link that will link in the description box. If you look on the website, it has programs in all across like the Hamilton, Niagara, Brantford region. When I checked, all of the programs that I looked at were free. So they're free of charge. Some of them are like 12 weeks. Some of them are a couple weeks. So they range and depending on what you're looking for, but all of them promote exercise and fall prevention. So do look into it. I know with COVID, some of the programs are currently on pause, but some of them are still going and still offering them. So feel free to look into that afterwards. Perfect. And just kind of touching on related to preventing falls in general, we had a webinar a while ago about long-term care homes and just the concept of frailty and addressing that when we're at a cognitive level where we can talk about it and share, our wishes for our care in the future. And we know that 64% of long-term care residents have a diagnosis of dementia. And as it progresses, it's more difficult for family members typically to take care of their loved one at home, so they're typically transferred to a facility. So I think it's really important to consider whether you want to have this conversation with your loved ones, especially just asking yourself, where do I want to be when I'm retired? What kinds of wishes and goals of care do I have that I want to share and relate to my loved ones and caretakers? And thinking about who will be my substitute decision maker and just thinking about these questions as we promote our brain health, I think it's really important. And on the right here is a frailty scale. So that goes from 1 to 9, 1 indicating really good fitness, and then 9 being terminally ill. It is a scale that kind of indicates where on the scale you are and your level of functional ability as well. I don't know if Dr. Curnew had a comment to make for this scale as well.
Yeah, so to me is that what you mentioned first of all is long-term care. Many of us are fearful of that and don't want to be there, but reality is that people go there when they can no longer look after themselves or their families can't look after them. So the two biggest reasons is memory. You mentioned things like Alzheimer's disease, and second is losing the ability to walk. And then and this shows up in the frailty score right now. So um, really think about this. And once, unfortunately, you're demented or you can't think properly, you lost the ability to rationalize, and someone has to make decisions for you. So if your mind doesn't work properly, you'll be resistant to change, and it's very sad to see that happen to all of us. I went through both those phases with both my parents, and I'll say is that you just showed us today what you can do to delay, or I'm not sure you can prevent everything, but you can make a great impact. I can be 7 years younger by eating well. I think I can be younger by keeping my weight down, keeping myself active. And I plan to be in practice for till God knows when. If all goes well, I'll retire on my 100th birthday, and hopefully my mind will still be working well, and I'll try to learn new thoughts. And so thank you for sharing that. So really think about what you can do to be healthier.
Absolutely. And just on the bottom right is just a picture of the video that will have the long-term care facility webinar if you'd like to have a look at it on our YouTube channel. And then this questionnaire, I think Dr. Curnew touched on it earlier, but it is the cardiomyopathy questionnaire. So it's an assessment of health-related quality of life, asking about symptoms and function of patients with heart failure. And I've added a couple of the questions here, I believe it's 2 pages long. We'll have it listed in the description box, but it asks questions about the current symptoms you're experiencing, how it's affecting your lifestyle and ability to do daily activities, and then we obtain a score based on that. And over here is kind of the scale that we look at. So from 0 to 25%, we consider it as very poor health status, whereas 75 to 100% would be considered good to excellent. And then anything in between there can be poor to fair to good. And Dr. Kearney, did you have any additional comments?
Yeah, so Adam was talking about our program where we're going to call it the cardiac device. We're going to actually do a Kansas City questionnaire at the start and at the end of that. And I encourage everybody to think about doing this questionnaire. If you look at last week's webinar on am I developing heart failure? Do I have heart failure and how bad is it? And how to treat it better? Look at that questionnaire. So this gives us today we're very rich in questionnaires to assess your health right now. So I kind of like this questionnaire, and I encourage everybody to do that and bring a copy in. It's a little bit hard to score, and if you can't score it, we'll score it for you. So we have a PDF of that. Last week's version was on the access or on the computerized form of that you can actually create yourself. But I'm not as computer smart as some of these young people. It gets my dementia starting to act up. But I'm going to learn a new skill on how to use that there. So thank you for sharing that.
If I may jump in here,
Of course.
just a quick thing. Yeah, just a quick thing for like for marking. Extremely limited would be a 1, and then quite a bit would be a 2, moderate would be a 3, slightly would be a 4, and then not at all would be a 5. And then you sort of tally up the score towards the end. And then if you tick the box limited for other reasons, or not due to activity, that's a 3. We'll say that that's in the middle. But then yeah, you sort of tally up the score, and then you could let us know at the end.
Perfect. Thank you, Adam. Perfect. And we are very heavy on questionnaires today, but everything will be linked in the description. So if you'd like to read them through and print them out for us, feel free to do so. All right, and we're almost done with the webinar. I just wanted to touch briefly on managing stress. I haven't delved into this webinar about what stress does to our bodies. We do mention it in our motivation webinar from last fall. But we know stress is not good for the body. It does a lot of physical and emotional damage for us. So taking it under control and taking proactive measures to focus on what you can control to manage stress is really important. And I put focus on what you can control as the title of this slide because I think a lot of times when we are stressed, and I know the patients I work with in our 3Ms group can vouch for me as well, a lot of it comes from the uncertainty about the future, the uncertainty about what's going to happen to you in terms of your illness, for example, or with COVID-19, what is going to happen in a year's time, where we're going to be, is this virus going to still be around? And a lot of those questions are centered around trying to figure out what we can't figure out. We don't know what's going to happen in the future. What we can do is focus on the present and take those proactive measures, which is why we're talking about this topic today. But in terms of managing stress, I just provided some things to consider. So, giving yourself permission to share responsibility. And I think this one particularly is for the caregivers who might be watching this webinar. We did a video about caregiver stress, but being a caregiver can put a lot of responsibility and burden on the caregiver. And sometimes it might feel like you're being selfish, wanting to take a break, seeking respite from that care and saying no to certain opportunities. But I think it's important to remember that taking care of yourself should always be your utmost priority, because if you're not taking care of yourself, it's so much more difficult to take care of others. And another thing that I always like to promote is to tell yourself something nice about yourself today. So thinking about something that you're proud of that you did today. Perhaps you exercised for 15 to 30 minutes. Perhaps you woke up today and you weren't feeling great, but you did something nice for someone else. And thinking about those things and putting it in a really positive light and just appreciating yourself. I think that's not something that I think our society necessarily advocates for, and that's really important. I think the mentality in our society is that we always have to be doing more. But sometimes whatever we are doing right now is just enough, and it's quite a lot. So just kind of turning it back on yourself and thinking of it in a positive light. I really encourage everyone to do that. And then the next couple are just things we've already talked about in previous webinars and videos. So taking some deep breaths, just closing your eyes and taking a moment to tune out. And taking a deep breath with your belly rather than your chest. And what I mean by that is instead of making your chest and shoulders rise when you breathe in, try to make your belly be the one that's inflating or expanding rather than your chest moving up and down. And you'll notice that it's a very different type of breathing called diaphragmatic breathing, but it's been proven to be very beneficial for patients with COPD, but also just patients in general in relieving stress because it helps us to breathe more efficiently. And of course, always try to have a laugh every day. We know that laughter has a lot of benefits. That's why we say laughter is the best medicine. So always try to find a reason to smile, try to laugh, try to spend time with other people. I think that always is something that really helps me when I spend time with other people. And seeking help if you need it. So seeking help through a therapist, through online therapy. We did mention that there are a couple online cognitive behavioral therapy programs online in Ontario that you are able to access during COVID-19 if you would like to access them for anxiety, depression, insomnia. So feel free to look into those programs as well. And then the last two, my personal favorite is meditating and just practicing mindfulness, which is one of the core concepts in our 3Ms group, is to just find opportunities to focus on the present rather than focusing on the future or the past, and just taking a minute to appreciate whatever is in front of you right now. And just in addition to the last point here about listening to music, Dr. Curnew mentioned this. I have not yet watched this movie, but he wanted me to mention this. So this is a documentary called Alive Inside. And it follows kind of the life of a social worker who introduces music to different nursing homes with patients who have been diagnosed with various dementias, including Alzheimer's. And as you can see here, I won't play the trailer, but if you look up Alive Inside trailer on YouTube, you should be able to watch it. But it has incredible reviews and has received a lot of awards about its content. And I think this is a really nice way to sum it up, is that music awakens in us our most profound sense of safety, the safety of being in connection with each other and with ourselves. And you just see that introducing music to these patients who have lost a lot of their memories and abilities, just introducing music does so many wonders for them. So I really encourage you to watch the film. I'll be watching the film this weekend. All right, so just to wrap up, this is the roadmap that we've really kind of come to at the end of our webinar today. So, eating well, exercising, sleeping consistently, being social, stimulating your brain, not smoking, limiting your alcohol, preventing falls, and managing your stress. These are all ways for you to promote your brain function and maintain that healthy brain for as long as possible, which is what we want. And I know Dr. Curnew touched on this earlier, but according to the Alzheimer's Society of Canada, we know that 1 in 5 Canadians have experienced caring for someone living with dementia, and I imagine that as the years pass, we might see an increased number. This on the right here is the video that we have about caregiver stress. We talk about different resources that are available for caregivers if you're seeking additional support through an extra caregiver or respite care. So I highly recommend you look into that if you are seeking those resources. And otherwise, thank you for joining us today and staying to the end. Please feel free to message us if you'd like to join any of our groups at drcurnew232@gmail.com.
Fantastic. I think this is really a tour de force of what one can do, and so I'm going to do some of those questionnaires. If you'd like to do them as well, and you can actually email them, bring them in. We can look at them. We can help score with you. We can help different plan of action for you. So Um, Adam says knowing is not enough. We need to call for action right now. So there's lots you can do to have a healthier brain for longer periods of time. And just want to thank the whole team here. Fantastic. Stuart, are there any questions out there on YouTube or anybody, any comments from anybody in the group wants to add anything to that? It's wonderful.
Yeah.
Keep trying to make these things short, but they're also great and so much information. Go ahead, Stuart.
Yeah, we do have a question actually, and it's a good one, and I'd love to hear your thoughts on it. The question was, does chronic pain or living with autoimmune disease affect brain health negatively or increase the probability of developing dementia? So chronic pain and living with an autoimmune disease.
Hannah, do you want to take that or you want me to take that?
I'm thinking if you wanted to have a go at it, go ahead.
Sure. Nothing good about pain, nothing good about immune diseases. So they all affect our health in a bad way. One of the things that chronic pain is a very interesting concept. A lot of what we're learning about pain is that it's becoming more of a learned behavior. So we can unlearn how to control that better. And Stuart, we're going to do a webinar on chronic pain in the future. Autoimmune diseases, that's a tough one as well because it just makes things harder to deal with. So it means you have more obstacles, but that way is when the going gets tough, the tough gets going right now. So I think what I would do when I have this situation, I would think about the 3Ms, the mindfulness meditation movement program to help in that circumstance to set the paths to relearn some things. We'll set some new neuron connections to make you healthy of that problem. So yes, it's harder. Yes, it leads to more problems, but yes, there's a solution. Any other thoughts out there, Stuart? Any other comments there? Great question. Thank you for asking.
No questions other than that at the moment.
Well, Stuart, I'm going to go exercise my brain again, and I'll give you the last word there, Stuart.
Yeah, well, I just wanted to thank the whole team for putting together a great presentation. I think what they did so elegantly was display a very convincing argument for how important it is to prioritize your heart health, and coming with that also comes with prioritizing your brain health. So those things kind of go hand in hand, which has been an eye-opener for me today. I think that what I really, really liked that Haley mentioned earlier when it came to diet was that oftentimes it's not realistic to think that you can do everything all at once. So I encourage everyone to come up with one action item by the end of today's presentation and carry forward with one action item for this month and see how it makes you feel after that. Objectively, I think that when you exercise or when you eat well, you feel better, and that's obviously helping your heart. But then when you feel better, that also helps your brain health. You know, you feel better about yourself, you have more self-confidence, you feel like you're doing the right things for yourself, and it's a cycle that goes back and forth. So I know that many times we often fall off the horse, or we have our bad days, our bad binge weeks. Things don't always go the way that we want them to in our life, and sometimes that can cause us to stress out, exercise less, eat unhealthy foods, drink more alcohol. And the reality is that it's just important to not be your own worst enemy, not to beat yourself up too much. Your body is your body, and you only get one, so you want to treat it the best that you can. Sometimes, like I like to think of my body as a car. You got to take your car in for repairs every once in a while. You got to go see the doctors, but all the other time it's your responsibility to try and take care of it by washing it, by following and obeying the rules of the road, being a safe, cautious driver. So I think it's important for you to take control of the vessel that you are living in, which is your own body. But again, not to be too hard on yourself when you slip up, because that happens to everyone, and it's not lost on me that we're oftentimes as students speaking to an older audience, but even we make mistakes and even we slip up all the time as well. We have our own stresses, which causes us to lead unhealthy lives, and we're all working towards the same mission of just trying to be healthier each and every day. So I encourage everyone to make one action item by the end of today's presentation and carry it forward, and then continue to build from there. So that's sort of my takeaway from today's presentation. I'd love to hear yours, Dr. Curnew.
So my action phase is to get an extra hour's sleep a night at this stage, and to continue to keep my curiosity, keep learning new skills, and I just want to thank everybody tonight, and let's wish you all a good night. And this is one I'm going to look at it again and again, and lots of good information. I'm going to do some questionnaires. I just can't remember what I had for breakfast today.
And the thing about the questionnaires as well for everyone is we've linked them in the descriptions, so you can print it out, you can take a picture, you can do whatever's easier. But also, if you just come into the clinic and you'd like to do a questionnaire, you can tell one of the volunteers, and we can work on it with you as well, and then we can show it with Dr. Curnew. So you want to make it as easy for you as possible. So even if you can't do them now, you want to take a picture of them and do it with us in the clinic, that's definitely an option as well. So. The reality is we want to make this as easy for you as possible. Technology is not always easy, and it's not always easy to explain over videos as well, and we get that. So if you want to just take a picture, print it out, or even just ask us, and we'll be able to help you out.
Good night, everybody.
Good
Have
night,
a good
everyone.
Good night, everybody.
Take care.